Okay. So I have 11:30, so in the interest of time, we will go ahead and get going. Again, since everyone's so familiar with Zoom these days, I will tell you that all of the attendees will be on mute the entire time, so do use that chat box if you need to ask a question. We're happy to do that with you. We are delighted to have so many folks with us here today. I'm Carol Westlake. I'm the Executive Director of the Tennessee Disability Coalition, and I am joined by my colleagues from the Coalition and Family Voices and the Tennessee Justice Center, who will introduce themselves in just a moment. Just to give you a sense of what we're going to talk about today is really providing some information and perhaps some ways to think about the recent concept proposal from TennCare and the Department of Intellectual and Developmental Disabilities on sort of transforming the system of long-term supports and services for people with intellectual and developmental disabilities. We're going to start today by talking a little bit about how we got to where we are, and some historical context to understand why such a transformational proposal is appropriate and it may well be needed in this age. We will answer some questions about that if needed, and then we will go on to talk a little bit about just providing a summary of what that proposal is. Many of you I know have read the concept paper as well as the FAQs, but we'll kind of try to give a summary for those of you who may not have been all the way through that. And then we wanted to spend a little bit of time today talking about some of the opportunities that this really, this kind of a proposal offers to folks with intellectual and developmental disabilities, their families and supporters going forward, as well as what some of the concerns or risks that we might want to take a look at as well, because we all need to really be informed and be able to provide real good input. So I think that'll be sort of our format. We'll take questions in between some of those topics, but that's how we will get going today. So again, I'm Carol Westlake, and Katie Ann, if you want to introduce yourself, and we'll kind of go down our group.
Sure. My name is Katie Ann Twiggs, and I work at the Tennessee Justice Center. I am the Community Outreach Coordinator for the Independence team that deals with policies and programs that affect people with disabilities and older adults.
Great. Donna?
I am Donna DeStefano. I'm the Assistant Director for the Disability Coalition and do a number of things.
Sarah?
Hi, I'm Sarah Scott. I'm an advocate for Family Voices of Tennessee, which is a program of the Disability Coalition. And I also do a lot of work with the public policy team.
Great. Thank you. Really glad to have everybody here today. So just to I think I will kick us off this morning, and I guess because I'm the old woman in the crowd, and have been part of this system and doing work with people with intellectual and developmental disabilities in Tennessee for a really long time. And we wanted to start off with a little context because I think history really does matter, and understanding some of the context about how we have gotten to where we are is important as we think about where it is we want to go in terms of moving forward as well. I mean, obviously, change is inevitable. The system has changed a lot over the years. The system needs to continue to change and to evolve. And that really means we all have a role in making that happen. So let's talk just a little bit about how we got to where we are in a system that is relatively fragmented. Most of you know we've got sort of separate DIDD 1915C waivers, home and community-based care waivers, and then we also have the Employment and Community First Choices program. We actually have a choices program for folks who are aging and those who have physical disabilities, as well as nursing facilities, and we have intermediate care facilities for people with intellectual disabilities. So there's a whole plethora of things that kind of go on that way. But Medicaid is obviously plays a really important role in long-term supports and services. You know, in the early days of our system in Tennessee, we were funded in the community with community dollars and state dollars, no Medicaid at all. It really has been in the last 20 years or so that Medicaid has been put things in the community. excuse me, that money has been able to be spent in the community. You know, the growth in services in Tennessee, because we don't have a rich state coffer, has always been one where there are waiting lists and there are things that go on that have been a problem. And so really, in the mid 80s, when Congress authorized the ability to use Medicaid dollars, not just in institutions, but in the community and in home-based services, Tennessee began to take a look at that. And it was a little bit later that we really got a big infusion of cash by converting to Medicaid and being able to use those services, use those dollars to provide services in the community. And we began to see the development of waivers, right? The home and community-based care waivers. As those waivers were developing, for those of you who've been around, you also know that we do have a legacy of legal intervention in the state. There were 2 CRIPA lawsuits. Those are civil rights of institutionalized persons that really took on the protection of people who were living in the state's institutions and who had not received adequate care, treatment, and services in those institutions. And that really also has impacted the development of our services and our service system. So while the waivers were being developed, the folks that were living at Arlington and Clover Bottom and Green Valley, many were moving out of those systems and into the community system. Waivers had to be developed, and a lot of policy that was developed relative to the service delivery system was really predicated on what the courts in the remedial order and the settlement agreement required happen to folks who were moving out of those institutions. And so what started as a small waiver for children, the Model 50 waiver, for those of you who remember, became a Model 200 waiver. We had a statewide waiver that was beginning to serve people. And as the lawsuits developed, you know, yet another waiver specifically for Arlington class members developed. And we really developed a system of waivers that that sort of segmented pockets of service. So a self-determination waiver that doesn't really have a residential component, a statewide waiver that did, and what we now have in terms of the comprehensive aggregate cap waiver that was formerly the Arlington waiver. So every time there's some pressures on the system, things would develop and be moved in order to make those kinds of things happen. And then for those of you who've been around a little while, you remember the days when, frankly, the waiting lists grew and grew and grew. The money in the system was growing, but it was serving predominantly those legal interventions and trying to get the state out of trouble with the CRIPA lawsuits. Important to provide those services to people who had been institutionalized and those class members who weren't able to get services. But frankly, we ended up really stalled for a number of years, and the waiting lists were growing, no services for folks, really problematic. And one way to get around that was to begin to take a look at managed care. After 1995, when our Medicaid program became the TennCare program and moved to an 1115 waiver, moved into a managed care environment for primary and acute care, we also converted to managed care a lot of other programs in the state. And as they, in children's services, for example, in mental health services, and it began to make sense to take a look at whether or not we ought to be moving to managed care for folks with intellectual and developmental disabilities as well. During this period of time of the growth of the waivers and the lawsuits and all of that kind of stuff, it's also important to remember that we really only served people with intellectual disabilities. Folks with developmental disabilities other than intellectual disabilities did not have any access to care at all. And moving to managed care was a practical way to be able to expand those services as well. So really, the development of the Employment and Community First Choices program did a number of things. It developed this managed care program, it expanded the population of people who were able to be served, it invested new dollars in the system that really gave us an opportunity to serve folks who had not been served before, particularly those folks who were younger and coming out of school and needed opportunities to build a real life. Really been a positive kind of thing. But as you know, the ECF program, Employment Community First Choices, I can say this, is probably the newest program that's been developed. And so I think that if you really think about it, and think about the context of how we got to this sort of dual system where some's in managed, some services are in managed care, some services are in these waivers. The waivers are kind of segmented. We have an overriding legacy of legal intervention in terms of those lawsuits. But if you look at ECF, its design, the policies, the benefits, the way it has been developed really gives you, I think, insight into the current sort of trends, values, interests, and targets of our service delivery system, of the policy makers and program developers who are putting things together. And I think that really gives us a lot of insights into the goals of the integration proposal that is just beginning. I mean, I think the state has been very clear that conceptually they have some important goals they want to achieve by developing this proposal and by sort of streamlining the system and really focusing their resources on the things that are the most important: less administration, better for people. But I think it also, you know, as always, history and looking at current practice gives us some insight into the kinds of ways that we need to move forward as well. So that kind of gives us, I hope, a little bit of background about where we got to where we are, the need for an integrative proposal, the need to really take a look at our system and to focus our energies on the things that are the most important for folks. So if there are any questions, I am happy to answer them. I don't know if we have any. We do have a question about the PowerPoint presentation. We are happy to send the PowerPoint out to attendees afterwards. Absolutely.
Right. And no questions so far. So,
okay.
Although a comment that from somebody that this is a very good event. Thank you for presenting it. So thank you, Bill.
Happy to do that. I was promising that I wouldn't go down too many rabbit holes in talking about history. This is what happens when you're old. You know, you think about all of those things all the time. So hopefully that gives you a good summary of the past. And Katie?
Yeah, I do have a question now. Yeah, so what does ECF stand for again? It's employment.
Okay. ECF stands for Employment and Community First Choices. And that is the name of the TennCare long-term supports and services program that now serves individuals with intellectual and developmental disabilities. I think that's really, really important. And the fact that it's both intellectual and developmental disabilities is I think a really critical piece to all of this. So,
great. So again, my name is Katie Twiggs, and I am going to start off the presentation about the summary of changes. I would like to say off the top that the summary of changes is a little vague at this point, because the information that we have gotten from the state in their notices is also kind of vague. So as I present, you are welcome to chat questions, and hopefully we'll be able to get to some of them after my presentation. But please understand that we are a little limited in our knowledge of it, because the information that's been sent out is still being created and being established. So, and we are continuing to advocate for specific details, and we'll pass on information as soon as we get it. So basically, all Medicaid programs that serve people with intellectual and developmental disabilities will be integrated into a managed care model under the operational leadership, management, and oversight of DIDD in coordination with TennCare. That's basically like a one-sentence summary of what the change is. So the programs that will be put under and integrated under this managed care model it includes all three of the Section 1915C waivers. These are also known as the DID waiver programs. And then also the ECF Choices program will be integrated along with individuals who receive care at an intermediate care facility for individuals with intellectual disabilities. And they receive that benefit through their regular TennCare coverage. You'll see it abbreviated ICF/IID. These managed, just for explanation, most people on this call probably know, but I just wanted to explain that a managed care model is where private insurance companies contract with the state to provide Medicaid covered services. So in Tennessee, almost all of our Medicaid or TennCare services are already being provided through a managed care model. Everyone who gets, almost everyone who gets on TennCare is assigned to either Blue Care, AmeriGroup, or United Healthcare. And it is in those companies who provide the health coverage. The ICF/IID benefit right now is being provided under a fee-for-service model, meaning that the state just pays the facilities directly. And so now that will be covered by an MCO, similar to the way nursing facilities are served by or paid for by MCOs when the individual is enrolled in Medicaid. And then the ECF Choices program is already being managed under a managed care organization model. And so the DID waivers, however, are not. And they are likely the individuals to feel the biggest impact of the change. That's what we're predicting, because individuals who are receiving home and community-based services through the ECF Choices program already are doing so under a managed care model. There are currently 7,000 individuals receiving care through the DID waivers. These individuals already may already receive some care through MCOs, but their home and community-based services that they get through the DID waiver programs will not also be provided through MCOs. And so the general sort of outline of management is going to be that the MCOs will manage the individual's care and pay for those services, and DID will lead the day-to-day management and oversight of the MCO contracts that are providing home and community-based services as they're providing home and community services. And then TennCare will continue to lead the management of the MCO contracts that dictate the provision of health benefits, including physical health, behavioral health, pharmacy, and dental services. So with this, the integration of these programs underneath one managed care model, TennCare hopes that has several desired outcomes for the integration. Specifically, TennCare hopes that integrating the programs under DID and the managed care organizations will streamline administration of these programs. We feel that this is like a pretty positive goal, given that the difficulties, that are expressed by in-home care providers that are trying to navigate providing care to both DID enrollees and ECF Choices enrollees. Hopefully, an integrated and streamlined administrative processes will make things be done more efficiently and is sort of easier to navigate for both individuals enrolling into the programs and also provider agencies who provide care to individuals who are on DID waiver programs or in the ECF Choices program. They're also hoping to align service packages so that all individuals enrolled in these programs have access to similar services. This is a little concerning to us because we're assuming that the DID waiver services will be managed similarly to the ECF Choices program, given that the ECF Choices program is already under a managed care model. There are service caps and limitations that exist in ECF Choices that do not exist in the DID waiver program. And all notifications from the state are saying that the array of services and supports that are currently offered will largely still be available, but they say we will leverage flexibilities such as enabling technology, telehealth, integration, training and consultation, and focus on supporting people to develop independence and natural supports. So we recognize that unpaid family caregivers and natural supports are super important, but they cannot be expected to take the place of paid caregivers. And right now, the communication from the state is that the services that are being provided now will largely still be available, but there could be some changes. And so we need to pay close attention to what services are included in the final descriptions of the new plan. And we need to make sure state leaders know how important current services are. We'll talk more about that at the end of the webinar. Funding for these programs is currently split into several different pots. So ECF Choices has its own pot and DIDD has its own pot. And in this integration, they'll put all of these programs into their budgets into the same pot. Currently, the cost of services can vary between programs. So sometimes DIDD waiver, you can be receiving nursing services through the DIDD waiver program, or home health aid through the DIDD waiver program, and also be receiving home health aid services through ECF Choices. And sometimes that reimbursement rate is different depending on the program. And so they hope to integrate or to streamline the reimbursement rates. And currently, notices from TennCare state that DIDD and TennCare will continue to work together to set rates of reimbursement and ensure continuity of network and services for persons supported. So we know that low reimbursement rates can lead to empty provider networks, and it can lead to difficulty in finding quality caregivers if the reimbursement rate is too low. So we just need to make sure that the state leaders don't cut reimbursement rates to make finding quality care even more difficult. The state expects that most waiver providers will still be a part of the program once the integration happens, but some may not. So this is something to be on the lookout for. And then they express interest in a value-based reimbursement system. Value-based reimbursement just means that that providers will be paid based on specific outcomes rather than the services that are being provided. We're not 100% sure what outcomes they will be looking for and providing reimbursement based on, but it's something to keep an eye on and to advocate for outcome priorities that best serve individuals in the program. And lastly, in the last few minutes I have here talking about waiver authority changes. So the state, in notices that have been put out, the state plans to maintain the existing 1915C waivers with modifications, and then they're going to submit a 1115 waiver request for concurrent 1115 demonstration authority. This seems to suggest that the DIDD waiver programs will exist under the 1915C waiver authority, while at the same time also under the 1115 waiver authority. It's unclear how exactly this will work, but because there'll be changes to the waivers, we know TennCare will have to submit changes to the CMS for federal approval. CMS is the agency in DC that monitors how states run their Medicaid programs and making sure that they follow federal rules about Medicaid. So usually there are state public comments for the public to comment on a plan before it's submitted to CMS. And then there's also usually a federal comment period before CMS approves a final version of the plan. We think it's worth noting that the state is not currently planning on ending the 1915C waivers, but putting the waiver authority under 1115 demonstration, which would allow them to end the waivers, We have heard that these waiver changes requests will not be ready to submit to CMS for another 9 to 12 months. But the reported goal of the state is to have full integration by July 1st, 2021. We'll need to stay aware of public comment periods, but also having input now from stakeholders and enrollees is really important. This is the time when service packages are being drafted and details of the plan are being formed. So we believe our voices should be involved in every part of the process. And again, we'll talk more about this at the end of the presentation. So before we start with our opportunity section, I just wanted to see if Donna found any questions that came in that we can answer before we go on to the opportunities.
Okay, that would help. Yeah, there's actually a couple of questions.
Sure.
One is, one asked about if we knew of, if there was any other state that had done something like this in terms of that. And I would say at this point, I don't think we do know that any other state has done something like this.
Maybe Carol has a better answer. I do know that Tennessee uses the managed care model, is sort of on the front lines of using managed care model for a lot of Medicaid services. But I don't know if any other state has.
There really are a variety of states who are using a Medicaid managed care model. States such as Arizona have been full in on managed care and long-term supports and services for a long time. Other states at various levels of integration of that. I mean, I think that based on our history and sort of how our system has developed, it's pretty unique to be approaching this right now, where we're sort of running this dual system and thinking about how you put it together. So I don't think that there's a lot of information or lessons to be learned from other places about that. I think that it is a little bit, it's a little bit new from that regard.
And the other question I think you answered, Katie, and was will the current waivers be discontinued? So you addressed that in your section, so I think we're probably good on that.
Cool, great. Well, if any other questions come up afterwards.
Actually, there are some that have come in since then. Okay. How will update information be communicated to the group?
Yeah, we'll cover sort of what's next at the end of the presentation. So we'll talk about how you can make sure that you stay up to date with changes and comment periods and things like that at the end of the webinar.
Okay, two more questions. Okay.
If we don't get to all the questions right now, then we can send a follow-up email and include some of those answers then if we don't get to everybody. But I think we have maybe time for another question.
One more? Okay. Yep. Could DIDD replace direct support providers with video monitoring as part of using technology and providing services?
Sure. So in the notices and things that we get, TennCare has expressed, TennCare and DIDD have expressed interest in looking more into technologies and how we could better use technologies to support people's independence and care. But they also recognize that doesn't take the place of a direct caregiver. And so it's sort of something to be on the lookout for, to see how much or how little they plan to use technologies like that. Sort of to be determined. It's not really clear right now how much or how little they plan to use those kinds of technologies.
Okay. Let's move on then, because there are other questions.
Sure. Yeah, we can just address those in a follow-up email as they come in, or yeah. Thank you guys for continuing to ask good questions, and I'll make sure that all of our emails are also available with the follow-up email so that you can ask questions.
And I think there are a few questions that have been asked that we might get to as the presentation goes on, or that might be more appropriate to answer toward the end to the extent that we know those answers. So thank you.
Right. Thanks. Okay, my part, opportunities. Woo. We'll go to the next slide. Maybe. The HMO provider tax. If you, for those of you that have, read through, I think everybody's read through the information, the state has talked about bringing in additional Medicaid dollars to the tune of $34.3 million. And that would increase state revenues. And many folks have asked, what is that? I don't understand that, because it's a little convoluted. But basically, there is a 6% tax that is levied on all health maintenance organizations, managed care organizations that do business in Tennessee. It's actually in state code. And that money is used it's state dollars used to match the federal dollars to draw down those monies for Medicaid services. So the MCOs get paid that amount back through an increase in their Medicaid reimbursement rates. It's all very complicated. You know, I don't know the level of details of that, but that's basically the outline of it. And the bottom line is it will increase the amount of money that the state has to provide services. Go to the next slide. And this is where the opportunities really are in terms of the system alignment. The state has talked about a single aligned system under the Department of Intellectual and Developmental Disabilities leadership. All three of the waivers, the intermediate care facilities for folks with intellectual and developmental disabilities, ICFs, ID, and the Employment and Community First Choices program will all be, you know, pulled together and aligned, and to be announced as to the details on that. And clearly the state is seeking input for that too. The other potential opportunity is that the integration for providers of the specific kinds of things like the incident management system, the quality assurance and improvement system, direct support, workforce qualifications, and provider qualifications, enrollment, credentialing processes. Right now, when you've got multiple systems with the old waivers, with the ECF Choices program and with the ICF's ID, there's different pieces and parts. So providers have to answer to TennCare for the ECF and answer to the Department of Intellectual and Developmental Disabilities for other items. Pulling those all together will integrate them. There'll be one system that then providers will be responsible for. And that sort of leads us into the efficiencies, because there'll be one entity that will be the Department of Intellectual and Developmental Disabilities that will direct the operational leadership, the management, and the oversight. So the Department of Intellectual and Developmental Disabilities will have one system for those incident management, for direct service training, those types of things. One entity to answer to, not two. One set of standards instead of 2 or 3. Reasonably, then we should see less conflict in standards for what the program outcomes should be for people with intellectual and developmental disabilities. Not having to have staff spend a lot of time on 2 different systems should reasonably reduce provider costs. And it should enable the providers to focus more time on what they're really there to do, is to provide the supports and services to folks with intellectual and developmental disabilities. So in theory, I mean, if all those things align and there is some good integration of those systems, that will produce better services and supports. And ultimately, it's also less confusing for individuals and families. I know questions have come up that relate to a policy being used in ECF that is actually a DIDD policy that there's no actual authority to be using in the ECF system at this point. But as things have been developing, they are using that. So this will give the opportunity to really do some good integration on those types of things and make it less confusing as to what the rules are. So that's the end of my part. And so Carol is going to read the questions here.
Okay, I'm trying to here.
I know.
Yeah.
And I'm trying to look too.
It turns out I'm not so good at all of this technology stuff. So there were no real specific questions around those opportunities, Donna, but I think that there are some questions I think that are a little bit related, which have to do with this sort of issue around sort of one set of rules and one set of rates, and really the opportunities that provides. And then there was a question about whether or not there were any sort of sweeping changes that people ought to expect relative to their loved ones. And I think the answer to that is we don't know at this point, because this is really a concept paper. It is not really a plan yet. And so keeping an eye on those things, paying attention to proposed potential changes, and commenting on those is going to be really, really important. So thank you. So we will turn it over to Sarah Scott to talk a little bit about what some of the threats and risks might be when you go for a big transformation or a big change.
So I think the biggest risk is that change has some consequences, and some of those are intended and some of them are not. And we don't always, we're not always prepared for those unintended consequences. And that's why it's so very important for us to be informed and ready to act on, telling our story and contacting our policymakers and making sure that they're informed. One of the things that the state has said consistently across their communications is that there will be changes to service menus and expectations. They want to align services and people's expectations. So we know that that'll mean that there are possibly different service definitions than people are used to. What that looks like exactly, we're not sure at this time. It could mean that there are less services, that they're packaged together differently, that they're just called different things. We're hopeful that they'll, as Donna was just saying, that it might be easier across programs to talk about things that are available or issues that are happening within the system as a whole, if everything, were talked about in the same manner. Definitely easier for families and advocates anyway. Another concern or threat that we've identified, and it has been brought up in our chat today, is the use of technology. How will that be utilized instead of in-person DSPs? We've seen the Department of Intellectual and Developmental Disability use some really great enabling technology to help people gain independence. They have some great videos about people who didn't need a lot of services in their homes, being able to really live on their own for the first time. And that's incredible. But a lot of folks who are coming from these old waivers are of high level of need. And the concern is, well, what will that look like? Will all of the in-person services be replaced with in-person technology? I have heard the term technology first approach. So that does signal to me that they are going to be looking to save money or be more efficient through the use of technology. So we're going to need to pay attention to that and be aware of the areas in which that will work for people and in which it won't. I think the largest, threat that we're having is what is this going to do to the provider network? Is it going to help? Is it going to cause people to be overlapping? We have difficulties in ECF right now, trying to find, for instance, behavioral providers. So if everyone in the system is now using the same provider network and looking for the same services, how does that look? Is it going to strengthen the system or make it more chaotic? It's just a whole lot of unknowns at this time, and we want people to understand exactly what they're getting from their services and what any changes to the system would equal for them. What does that look like? Less hours or a different application? How do you plan for something in advance that you didn't realize until afterwards, was a big issue? Other things that we have talked about are, behavioral and residential services. Those are difficult in ECF, which is the standard that they're building this integration off of. So it's harder to think about what any of this might look like as a whole system when it comes off of a program that is already challenged and has some rather large holes that families are already advocating through. So it's great that they're putting out, a concept paper and have given families opportunities to really learn about what's going on, but there's just not very much detail, and that's been difficult for us to put together any kind of firm guidelines based on those holes in their information. I think people are looking for a lot of yes or no and black and white. These are the threats. The biggest ones are going to be, changes to services. But we don't know what that will look like right now. Do we have some questions?
If I unmute myself, that'll help. We've been trying to answer some of them. There's a question, would it be possible for someone now in supported living in the 1915C waiver might have to change provider agencies if the person is with one MCO and the provider currently providing supports and services doesn't contract with that MCO?
We don't know. That's going to be difficult. I've seen some questions in there also about will that be integration across MCOs or with each MCO? We just don't know the answer to those questions yet. We hope that it will equal increased efficiency, and that will be easier for families and providers to use. But the concern is that there will be some issues like that there will be holes within.
So Sarah, there's also a question about whether there's any reporting or evaluating of the effectiveness of the ECF program about what's working and not working, so that TennCare sees and doesn't make that same mistake. I think that really speaks to advocacy, if you want to just say a few words.
Sure. So there is some mechanisms for sort of evaluating the effectiveness of ECF from a family and consumer perspective. All of the MCOs operate advisory councils. Each one has one in each grand region. So they get a broad feedback from different areas of the state. They're very interesting because they are mandated to include both consumers themselves and family caregivers. And each MCO does take the questions or concerns that are brought up at each meeting and report them to TennCare, and then come back to their group with the response that they got. There are varying levels of what that looks like between the MCOs. The largest one is more organized and gets maybe a little more detail with some of their feedback. and some of them are a little more informal. But there has been a certain process established, and that's good, I think, because we're able to track how long ago was this concern brought to the table, what steps were taken after that, how was it resolved, do we need to address it again, and that's what we do at the Disability Coalition as well, with individual families or individuals who contact us needing advocacy help.
Thank you, Sarah. So there are a number of questions and issues that were raised that we simply do not have the answers to. But you know, one of the things that was raised was really about the comprehensive aggregate cap waiver. That is to say, the waiver for folks with the most significant disabilities and those who were part of the Arlington class from the lawsuit have a waiver in which the budget neutrality that's required in a waiver is looked at collectively across the entire program as opposed to on an individual basis, so that if there is an individual who happens to have a pretty expensive service package in order to keep him or her safe and well in the community, you can exceed the cost of institutional care for that individual because overall the waiver is budget neutral. There is a risk of losing that, I think, depending on how this alignment goes and how service packages go, one thing and another. And I think that's one of the things that we all need to pay really good attention to as a plan and program gets developed. And that's probably a message that we need to deliver around folks who have extreme needs in many cases and have a more expensive program that is needed. A couple of questions were also raised around being able to manage complex behaviors for folks and really building that into the system. I think that has continued to be a problem in some cases and in some places, and I think that the state has really tried to, TennCare has worked on that in trying to develop some crisis services and trying to develop some issues around like groups 7 and 8 for those of you who are familiar with Employment and Community First, but those are really sort of crisis and short-term and stabilization programs. And I think that one of the opportunities we may have as advocates and people who care about those with complex behaviors is really to say, while we're transforming this system and while we're talking about values-based reimbursement, strong behavioral supports needs to be a value. And so I think that's really something that is important. Someone did ask a question about an example of paying for outcomes. And I will tell you that the state has not really started talking about what those values that they want to promote will be in terms of reimbursement. But I think a good example is in the Choices program in the nursing home field. We can look at history and look at things that are currently happening. And there are a set of outcomes that the state has laid out for nursing homes that might be things like a reduction in the use of psychotropic drugs in a facility, or health outcomes like reducing the number of urinary tract infections among residents in a nursing home. And those would be values that folks would get extra reimbursement for if they met certain targets. So hopefully that is helpful. I know we only have a little bit of time left. Well, we got a few minutes, that's good. So I'm gonna quickly look. Donna, were there any other questions that we need to answer at this point? Or we can maybe just talk about sort of what happens next. I think that what happens next is that we need to move from a concept to a plan, right? The TennCare Bureau and DIDD have been very clear that they want to hear from folks, that they do not have all of this cast in stone, and that's a good thing because the people who are affected most by this kind of a plan, that is to say, individuals with disabilities, their families, providers, support coordinators, all of us who are stakeholders really need to have our voices heard and to be able to move on that. So I think that they have announced that they are going to have listening sessions that they have planned. So stay tuned. We are at the end of our presentation. We will give you Sarah Scott's contact information. She's going to keep up with all of you. We will share the PowerPoint. We will give you a place to sort of sign up for updates. And as we learn things, we will share them. So we will keep going on that. I think that as they develop a plan and begin to move on, as Katie Ann told you, they plan to modify the DIDD waivers, one or more or all of them. That process involves sort of putting in a proposal and doing and requesting those changes to CMS. And so as that goes on, there will be an opportunity for public input on those kinds of things, both in Tennessee and then at the CMS level. They also propose that on their TennCare waiver request to move the programs, the DID waivers, into managed care will be part of a request relative to our 1115 waiver. And again, there's a formal process for there being public comment on the front end before that request goes to CMS, and then CMS also provides public opportunities to make those comments. So that's really important. I will say though, and as an advocate, I always say, you know, here's the deal. Getting input during those listening sessions, working with policymakers now is going to be really, really important. Because once those requests are put together, it's a little bit, I mean, you can still have input, but you know, the train's kind of left the station at that point. And so it's really important for us to all work together on the front end. So what can you do? We would suggest that you learn everything that you can about what is happening, that you sign up for updates, that you think about the things that are most important if you're a family member or an individual with a disability, what's most important to you about what works in the system and what doesn't work, and what questions you have. You need to ask those questions. It's also really important to share your story. This is something that we talk about a lot in advocacy. But I think it's very, very important for policymakers, that is to say within the administration, within TennCare, within DIDD, but also fundamentally legislators and other policymakers, your elected officials need to understand that where the services and supports that the state provides to vulnerable populations is really important in our state, and doing it well is important. And they need to understand the impact of the policies that are developed in our state. So I would say that engaging policymakers is also a very, very important thing to do. Get to know them, be sure to share what is happening to you, and that really will make a big difference. So finally, I would say that we would be delighted to stay connected with you. With help for sharing your story, for getting more information, we'll send you a link following this where you can sign up for email updates. So as we get information, we will share information with you as well. Someone asked, would we consider doing something like this on a routine basis? I think we would, because I think it's really good for all of us. I really have benefited from some of the questions you all have raised this morning. I think we moved into afternoon. It's really, it takes everybody to build a system that works for everybody. And so I would just really encourage you to continue to be a part of the discussion, of the dialogue, and to use your personal expertise, because you all have it, to help improve the system, to help build this plan, and to help make sure that we develop a system that is efficient, that is effective, but that fundamentally meets the needs of all Tennesseans with intellectual and developmental disabilities. So I think that would be my bet. If there are any other questions here at the end, I think we have a few minutes. We can try to answer those.
There's a good question about whether the coalition's planning to organize any requests to be at the table as advocates during the continued planning.
Absolutely. I mean, I think that there are a number of organizations and interests, and we all need to be at that table. And we all need to share information with one another and work collectively to make it happen. So I would say yes.
There's another question that's related to what they currently have in the Department of Intellectual and Developmental Disabilities with the Planning and Policy Councils, and whether we foresee those continuing. I think we don't know. I think it's important that the state have a mechanism that is on an ongoing basis, that has stakeholders that they hear from.
Yeah. So I will tell you that the policy and planning councils are statutorily required. So yes, we will continue to have policy and planning councils because Title 33 requires the department to have policy and planning councils. The effectiveness of those councils depends on the effectiveness of the people who participate in those. And so I would encourage you, and I know Sarah Scott is a member of one of the policy and planning councils. It's very important to have that seat at the table and to share what you need to in order to improve the system.
Let's see.
There was a question about who to contact for our personal story. That would be Sarah Scott. We can put that, you want to put that slide back up, Katie Ann, do you mind?
Yeah, just give me a second. I'll pull it up.
Sure. Bless Sarah's heart for agreeing to take all of the incoming from all of you. And again, we will send a follow-up email to each of you who have participated, and we will include in that a link where you can share your personal story. We'll kind of have a little repository, and we will also send out the PowerPoint, which is not that interesting, but if it's helpful, we'll be happy to do. So there it is. There's Sarah's information.
And there is sort of a question about a family-based provider having different questions than other folks might have. There's a lot of stakeholders in this system. There are a lot of different kinds of providers. There are families and individuals that are receiving a variety of different kinds of services. So there are going to be different questions and different concerns. So I think it's important that everybody provide the input as the state sends out additional information as to their listening sessions and the other opportunities to comment when they submit something to the Centers for Medicare and Medicaid Services. All those junctures are going to be critically important for people to the state to get your questions, to get your concerns, to get your thoughts. So it really is a group effort.
Absolutely. So there's one more question that just came in about, is there a place where all family questions and concerns via the MCO family advisory committees are collected and accessible? I would say I don't think so. I mean, the MCOs really do operate independently. They all are required to have a family advisory council, but they don't necessarily coordinate those with each other. I do know that a number of the MCO advisory committees or the MCOs will elevate certain questions to the TennCare Bureau. So they might have some little bit of a compository of that someplace, but it is not something that is generally accessible to those of us in the community.
Yeah, I would just add to that, they separate what they consider to be an MCO issue and what they consider to be a TennCare issue. And those are tracked on separate ways.
Yeah.
Thanks, Alana.
Good. Okay. Well, thank you all so much for joining us today, and thank you, panelists. Appreciate all of you. There are as many or more questions than there are answers, obviously, and there will continue to be plenty of questions. I would encourage you to ask them. Ask them of your policymakers, that is to say, at the TennCare Bureau, at DIDD, of your legislators. Talk to advocates, talk to others. We'll try to get those questions. Well, maybe we'll try to figure out a way to begin to gather some of those up so that and find a place to share them so that people can take a look at that. Because I think, people's questions help us think about our own questions, right? And about our own situation. I think that can be really, really important. So, Katie Ann, are there any final words from the Justice Center? Thank you so much for sort of setting up this webinar for us.
Yeah, and I once the video of the recording gets downloaded and all that, all attendees can look forward to getting that email, and we'll provide you with links. Also, Sarah's contact information. Provide you with links to sign up for update newsletters and update emails and that kind of thing. So, thank you all for joining us today, and yeah, being a part of the advocacy moving forward. This is the beginning. So
Just the beginning. Thank you all. Have a good day.